Okay, good afternoon, everybody. Hold on, we're gonna get started on the mental health committee meeting. Without objection, I'm going to swap. I'm going to swap items number 1 and number 5 around, so the consultants don't have to sit here for the entire meeting. If everybody would please rise and join in the pledge of flag. Pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Victoria, will you take roll, please? Thank you. Amo? Here. Bailey? Ellers?
Here.
Feller?
Here.
Tui?
Here.
Ramos? Here. Sutherland? Here. Sutton? Here. Seven present, one. So at the table, we have Chair, Chairman of the Valley View Advisory Committee,
Make it quick, it's time to.
Michael Amo. Yeah, go ahead.
Yeah, we've
please.
been meeting 3 or 4 years and we put an RFP together that brought these guys on to give us a master plan of what we might be able to do with Valley View property to enhance the success of that property and to help work on aging in place and those kind of things for the people at the shop. And they're here now at the end of the entire contract to give us the findings, which we then will just accept. In fact, if they're on the committee, I don't think it requires a vote. I don't think there's any vote, it's just a matter of accepting it, and then we move from there. So, do we need a vote? I don't think so, just an accepting on the minutes, on the record, and that's all. Yeah. We received it. Yeah.
Okay.
Go ahead.
Received
Brian,
and filed. Everybody should also have in their packets the presentation packet. They're not going to go through every slide, just an overview. And you should also have it by email. There we go.
All right. Thank you.
Thank you.
My name is Brian Ellsworth. I'm Vice President for Strategy and Policy with Health Dimensions Group. And I am pleased to be joined by my colleagues from Community Living Solutions. And we were privileged to be working on this project to develop a master plan for intergenerational continuing care campus. These slides will be posted on the internet. And so we're just going to do a fly through here to give you an idea of the process we followed and then the findings that we came on, and be happy to entertain any questions that you might have.
After that, I believe that I was told by end of business tomorrow, they'll be on the website. So don't call us at 9:30 in the morning. We'll do our best.
And it was a privilege to serve Orange County on this project, and we are so excited to share these findings with you.
Thank you. It's been a pleasure working with you.
So just a little bit of level setting. The RFP that was issued, I don't even remember when this was, called for the creation of a master plan to eventually be executed by a developer and be sustainably operated by an outside operator. And this master plan was going to look at the developable land on the Valley View campus, as well as repurposing space in the Perry building. One of the dictates was that this plan must meet the needs of the community and sustain the long-run viability of Valley View. And in addition to options such as housing and new programs, the county was also seeking creative ideas, and we hope that what we've brought to you today meets that. So this is the project's structure and timeline that we worked on this project. It's been just over a year, and the final report is being presented today. So one of the things that we did was a market assessment. We looked around and there were some interesting dynamics that we found in this market here in the long-term care area. Has been an increase in the complexity of residents in assisted living programs throughout Orange County, as well as high Medicaid penetration. At the same time, if you look since the pandemic, has been a significant reduction in the market-wide use rate of nursing homes, with a lot of that census reduction being borne at Valley View. So with that as kind of background, we undertook a market study and we examined the zip code of origin of the residents of Valley View nursing home and developed what we call a primary market area. And that's really the area shaded in orange. And then the secondary market is the rest of the of Orange County. And so that informed our market analysis. And among the things that we found was that the population demographics of the Valley View primary market area, the age 75 cohort is growing by close to 20% over the next 5 years. And I don't think that's a mystery to most people that these are mirror the trends that are going on nationally, although this is a bit more pronounced than we see in some other markets. And we found, we looked at supply and demand of what we call market rate senior living, which is market-based senior living, 3 categories, main categories: independent living, assisted living, and memory care assisted living. And we found need over the next 5 years in all 3 categories. And you can see on the slide, 126 units, 63 units, and 41 units respectively. We also looked at affordable independent living, sometimes referred to as senior housing, affordable senior housing. And we also found significant demand there. Most places that we looked at had wait lists, lengthy wait lists, and were fully occupied. And just by way of example, there is an example of this level of care on the Valley View campus currently in the form of Hearthstone, which is a affordable independent living provider that's in the corner of the Valley View campus today. So we undertook a conceptual master planning process, and John, you'll walk us through there.
Good afternoon, everybody. So the conceptual master planning process, our goal of this is to first understand the community that we're working in Orange County on the Valley View campus, and then from there guide you through so that you understand from our perspective what we think the best outcomes are going to be. So to do this, we did what we call stakeholder meetings. So we identified with the advisory committee who would be the stakeholders that we should gain feedback. And when we look for feedback, it's in 3 buckets. It's number 1 is how are we performing for the community? Are we fulfilling our mission? Number 2 is how are we doing from a reality standpoint? What's our current reality? And finally, as we look forward towards growth and relevance, what are some things that we'd be interested in learning or aspiring to do? So you can see here in the slide that these are the 6 groups that we had those stakeholder meetings with, some in person and some virtually. The findings from the common threads that we heard through these stakeholder groups. So we take all that information, we synthesize it down. Number 1 is the Valley View is valued by the community. You know, great care being provided out there, but yet we all know that the campus is outdated. Number 2, it's important that whatever we create is affordable for all the citizens of Orange County. Creating a means for people to actually come there and also gain knowledge and resources to help them understand what's best for them. Number 3 was create a continuum of care that promotes aging in place. The 4th one, transportation, was a topic a lot in, it's a beautiful campus, but it's not right in downtown, right? So having to find a way to get transportation out there, both for the people that might live there, but also from a workforce standpoint, really important. The 5th one, you know, really looking where can we have partnerships. So we talked a lot with the Office for Aging and how, you know, their aspirations to be on that campus. working with educational institutions to try to get, some clinical, programs going through the campus. And then finally, the final thing is, we wanted to be a resource. There was a lot of conversations. How do we make this campus be a resource for all the citizens of Orange County and maybe even greater? So there's one spot you can go and you can get information on how to navigate. Maybe you're my age, you're 63, and you want to figure out how to navigate for social security in the future. So when we take all that information, then we create design principles, and that's these principles, and I'm not going to review them, but these principles are what then we use to develop the plan that you'll see that Tom will walk through. These are the design principles. Tom, I'll hand it over to you. Let me take these.
No, it did went the wrong backwards. Oh, yeah, it's touchy.
Just touch.
Those are
So here's what we heard then as we went through the feedback summary. So what we do is we take those design principles, and what we do is we create a plan. And then we get feedback from the Valley View, the advisory committee. We go back, if you will, to the office, revise the plans. And we keep going through these iterations to find something that actually works for that comes up with the outcomes that you want. So here, the feedback we got from one of them was affordable housing and memory care. We want to create affordable housing and have memory care on the campus. A lot of discussion about the Perry building. How do we best use that? Tom will share the solution for that. Welcome Center, we talked about that a little bit. What could that be? What could that be for a resource for the community? Could that be a space for the office for the aging to actually do their congregate meals? They believe that there's a lot of growth and need in the community. Can we build something that helps them grow and better serve the community for people living in their homes? What are the county needs? I talked about the meal program already, and the growth of that. One of the comments was that a sale leaseback is not considered an option in the programs for the county need to be in a county building.
So then that leads us to the conceptual framework. Essentially, it came down to three distinct pieces, which would be county buildings, the developable parcel, and then the Perry building repurposed essentially. So those are the three areas that we would look at. The first one is the developable parcel. As you know, it's the vacant land right now. It's approximately 72 acres adjacent to Valley View. So that's the first one we looked at. Then we looked at what can we do to have a continuum care, variety of choice, different living options that we could create. So on our final plan, we created some apartment buildings, assisted living, memory care units, and then active adult. So these are just kind of a breakdown of what we have on the plan right now showing. These are the amenities that we are suggesting that you include on this parcel of land, just to kind of create interest and things to do on that parcel and create that area where people want to go to that space. And then, these are the key attributes. Like I mentioned, it's approximately 72 acres. There's proposed use aligns with the market study that HDG had put together. There's definitely a need for it. The site would be able to be phasable. Essentially, you could build in the different buildings that we're showing on the site. You can do in different phases. You don't have to do the whole thing all at once. It could be kind of tackled on piece by piece. It would be a great feeder to the Valley View nursing home because you could kind of create the continuum care on that campus as you move along. It has great views. If you're up on the top of the hill where we're showing the current independent living apartment complex, you'd have great vistas down that valley. So it'd be a great area for that. Brings additional amenities to the campus, which I mentioned. We could create different, and then it would also create seed capital for county initiatives of the Valley View campus. So we included a couple of pictures of some existing, some examples of what these buildings could look like. It comes in all shapes and sizes, essentially. Again, these are some assisted living and memory care options that you can see. And for memory care, it's important to have wandering paths and then secured courtyards. Make it a residential feeling and make it more like a home-like type environments. And then active adult living examples. This is where we're showing examples of like twin homes, townhomes, walkable communities, things with front porches, getting people on the sidewalks, really trying to create the active adult atmosphere. And so then we get into parcel 2, what is the Perry building repurposed to affordable housing. Essentially, we looked at different options and we thought that the affordable housing would be the best option for this Perry building. Here's the site plan for that. So here's a blow up floor plan of that project. So what we're looking at is we could have 24 units on the first floor and 25 units on the second floor, essentially, of affordable housing. Different one and two bedroom units of different sizes that we thought we could tie it in. And there's would also be some adjacent building remaining in the far that is kind of tucked into the side of the hill that doesn't have windows, that's not conducive to living features, that we thought maybe that could be a kitchen used for some of the meals that Brian had alluded to earlier in the report, or a different function that's yet to be named. So it's a space that's still there, be a great space to use essentially. This is the second floor, essentially. This kind of shows all the different living options again. And just being able to use the existing assets that you have to make it an affordable housing resource. These are the kind of the attributes again, like I said, a feeder again, and these are mentions I've mentioned already. The third parcel would be the Welcome Center or the county office building. This is we're showing a location on the front edge of the parcel as you kind of walk in. It's kind of like a welcome to the campus area. So this would be create senior services. It could be a resource center for all Orange County, as we've discussed before. It reduces the landlord-tenant and relationships, trying to relocate different offices into this building that would create kind of combine resources into one area, and brings multiple agencies and programs to the Orange County or to the Valley View campus. So it kind of relocates everyone to one location. This is the space program that we use for that building. So all in all, this is kind of a recap of the whole Valley View reimagined, kind of creating that continuum care, if you will. So the developable parcel, we could have 32 units of AL, could have memory care, could have 80 units of independent living, active adults, amenities. That's on the developable parcel, many different living options. Then the rest of the campus, we're able to repurpose the Perry building into affordable housing, and then create the county building for Welcome Center and senior centric.
Or just the kind of like earlier, you're 63 years old and you live in Port Jervis and you say, how do I plan? That's what the Welcome Center is about. We could go in there and say, can somebody help me? We've got all kinds of services here already available to the residents of Orange County. We have kiosks and whatever. Just that's what we just make it easy to start the process.
And then this is the proposed final map. As you see, we labeled all the 3 parcels on there, parcel 1, 2, and 3. So we got the Welcome Center, the Perry building, and then as you can see, the campus plan that we laid out. We put the IL building at the top of the hill because it's the multi-story building that would be able to have great views down the valley. And then we get the low height buildings as we walk down the hill, so you're not blocking that view down there, so everybody can achieve the same view. And then the local amenities, as you can see in the site.
Those are houses.
Those are houses to the bottom, correct? Those would be,
Some might be rental and some might be for sale, whatever developer wants to do. It could be
I'm sorry if I may. I'm surprised so many townhomes. Aren't townhomes 2 levels? Would make it more difficult.
you can do townhomes. You can also do 1-story townhomes. So we are showing, like you said, it's a mixture of townhomes, cottages, duplex. It's just all levels essentially. Yes.
Because I know my dad's in a 3-level, and it was a stupid decision on his part, sorry,
Sure.
Dad, to purchase that because now he's, 81 and he's got 3 levels, he's got to go up and down.
It's fair.
So,
It's fair.
Yeah, no, this would all be designed with aging in mind.
Accessible, wide doorways.
I think the assignment.
but my point though is
Sure.
he's going from one
Yep.
level to the
Right,
next, with
We're seeing some of
stairs.
them where the senior lives on the first floor, and when family comes to visit, they're going upstairs. We're seeing some of those, and that's how they're actually leveraging it. So there's a lot of different options.
When we began this process, and know that the sense of the legislature and the county's office is that we're going to do it for somebody to help us develop it. And that's what we come to say, we'll have that kind of conversation. You want to develop, oh, this is what we want. And we'll have a say in it. We'll negotiate it. To the contractor that wants to come in and build it, so then we can be real clear. This is sort of an idea. How could we make this whole thing work together if we wanted?
And to that end, we conducted some financial analysis, and we really looked at two things. We created a capital budget, which I'll talk about in a second, as well as an operating budget. And the purpose of the operating budget was just to model out is what we're proposing, would that be attractive to a developer, a private developer? And the answer to that question is yes. And so we went through that exercise to make sure that we were proposing something that would be financially viable. In terms of the capital budget, we went through a whole process of basically framing out all of the items that we're proposing in this master plan. And the folks from CLS worked through some standard kind of parameters in terms of low and high budget for constructing these various things based on square footage and other metrics. And basically, the bottom line is, without factoring in the cost of land, that this is somewhere between $110 million and $140 million in terms of developing all of these various things, including, for instance, renovation in the Perry building, construction of these various other things in the developable parcel. And the various capital costs of these would be borne by the developers that would be speaking to each of these items. And we'll talk about that in a second. This just gives you an idea of the rents that we're talking about that we used in our operating model. And it's important to note that there's a range and there's a range of services, and we're also thinking that there's going to be a range of rental versus ownership models, and we'll talk about that in just a moment. So that gets us to the recommendations. And so there's really two big recommendations. Recommendation number one, which is consistent with the original RFP, is that the county should issue a request for proposal for developers with experience in senior living to develop the campus in a manner consistent with the master plan. And as part of that RFP, you should consider segmenting the RFP into 3 subcomponents, as we have described in this plan. We think that makes the most sense, and somebody could conceivably bid on all 3 or just one of the 3. And then within the developable parcel, we further suggest that you may want to segment that into property for sale versus long-term lease. And on this slide, I explain the whys and wherefores on that. It is conceivable, based on talking to developers, that there may be some interest in a long-term lease for the components of the master plan that are going to be rental model, and that a lease from the county aligns with a rental model with the consumer. And then for the other components that might be ownership model, that there it might make sense for the county to sell the property for those pieces. And then for the affordable housing component, that is really kind of a different financing structure altogether. Those will generally be financed with low-income housing tax credits. There are developers out there that specialize in that line of service. And in fact, that is more or less the path that was followed with Hearthstone. So you actually have an operating model of how that would work. So that's recommendation number 1. And then recommendation number 2 goes back to something that we found as we first came upon the Valley View site. And after we had done some on-site review and some investigation, and then we also read a report, a facility condition assessment report that was conducted by the county some months before our engagement, that basically indicated that the Valley View nursing home campus itself was in need of somewhere on the order of $50 million in repairs and renovation. And that report broke down the repairs and renovation into three major buckets. And considering that that area was out of scope for this project, however, we feel that it's pretty important to take a look at that whole issue as to how much to do of that versus new construction or complete redesign in conjunction with the other elements of the master plan. So we are suggesting as a second recommendation that the county issue an RFP that will propose to bring this modernization of Valley View into the scope of the master planning process.
I think Lawrence will probably talk to that more as we get down, because he's the expert in the area, but we're in this market of long-term care with sexy cells. You haven't got the newest equipment to do these things, what's going on, and people are going to look elsewhere. And so we want campus to be really aging in place, and we want that to happen. We want a facility that's going to track that. They got to work symbiotically together. And so that's sort of some of it, but what it looks like and what we do is up to Lawrence. And I think he's already thinking about that at some point. So it's beyond this project. I think Lawrence is thinking.
And there are Medicaid reimbursement implications once you get to the nursing home. And there's also operating cost efficiencies. So there are potentially ways to get some amount of reimbursement for that and some amount of operating cost savings. So there's multiple forms of payoff there. And so this is a sample scenario that we put in the report that is really just an example of if the nursing home were in scope, how might you modify the master plan that we have just proposed to you. So that is there really just for information purposes only. So the last part of the charge of the RFP was to assess the impact on Valley View Nursing and Rehabilitation Center. And our basic statement there would be, in terms of the master plan, the key issue is what you do with the proceeds of the sale of property and the lease in terms of funneling that back to reinvesting that in the Valley View facility itself, either to sustain operations and or to modernize it. So that's probably the number one consideration that you have in terms of the impact on Valley View, is making sure that whatever you do will reinvest in Valley View as intended by the RFP. Then secondly, there are some specific positive and negative impacts. And in terms of positive impacts of the master plan on Valley View, as was mentioned, it's the potential for serving as a feeder for residents for Valley View, not only the nursing home, but also the certified home health agency that Valley View runs. And secondly, there will be expanded attention to that campus, and it will serve as a heightened awareness. And then thirdly, to the extent that the transportation problem is solved, that's also going to help with staff for Valley View as well. On the negative side, it's possible that the memory care assisted living that we're proposing in the master plan could compete with the small private pay memory care census at Valley View. And secondly, that the expanded services on campus may have the potential to compete with Valley View for scarce staff. So we think on balance that this has the strong potential to be very positive for Valley View. But you have to make sure that it's reinvested properly.
I don't think we talked a lot about it in the meeting. Martin, Lawrence can help you probably a little bit. Is that to attract staff and don't want to work in skill. It's really not the top order of nurses that want to go to work. You don't want to go to teaching hospitals, they want to go to those things, and some of them go to skill. So you really want to bring them in. One of the ways to bring them in is showing them state-of-the-art equipment. You're doing state-of-the-art clinical care, and they're gonna wanna go and work. And that you get when you do that. And modernize a building, so you really offer something. Hey, you can attract some people, you can have imaging equipment and stuff that is really sort of critical to draw people to work. It's so much better than another place in the county. People wanna work.
Thank you very much, everyone. This is wonderful.
One question, if I could.
Yeah, go ahead.
How many total units again, livable units? Was it
Um,
between the rentals and which on the, for the
It's in
high.
your presentation that we have 13.
so,
Yeah.
is that what it is? I don't know. if
I added three numbers I saw.
There you go.
Yeah.
Yeah. And, so, as you can see there, 32 units, assisted living, 16 memory care, 80 independent living. 88 units, active adult, and then 49 units of, affordable housing.
Thank you.
I can tell on behalf of the whole
Page
committee,
37 of the presentation.
the whole committee, I think that there is, to my knowledge, nothing around here, maybe in this state, that is a really active intergenerational aging in place campus. We could really, as a county, go off and be labeled as the people who are thinking ahead, and thinking so much differently about how do we take care of people who are getting old and need to have the right kind of care. And plan for that better. We can do some really interesting stuff if we want to. We can put us on the map. It's up to us.
Thank you, Legislator Amo, and thank you, gentlemen, for your diligence and your compassion and your hard work during this process. We appreciate it.
Thank you so much.
Thank you very much.
Yes,
See you later.
Just on the screen.
Lori, thank you for shifting around.
Yeah,
You're right, you guys.
Up next, we have, up next, we have Lacey Trimble, Commissioner of Social Services and Mental Health. Hey, Lacey. So item A, we have request to accept and appropriate state funding from the New York State Office of Mental Health. This funding is for COLA and targeted inflation increase, $247,459. Legislative request number 231. Can I have a motion, please?
Make it-
Second.
Whatever. Pick a name out of the basket.
So these funds are from the New York State Office of Mental Health. They include the normal COLA, cost of living adjustment, but as part of the budget process, they also did a targeted inflationary increase. And this was a certain percentage, I believe it was 2.1% of an increase that was designated for certain positions for direct service professionals across certain agencies. OPWDD had some, OMH had some, and OASIS had some. These are for the OMH targeted increases. So these are increases that can't go to executive staff, support staff. They are for direct service providers, with the hope that increasing those funds for our agencies would help them to attract and retain staff.
Okay, thank you. Anybody have any questions? All in favor? Any opposed? Up next, we have your monthly update.
So one thing I just wanted to mention, I know I've mentioned the naloxone map before, but it has had its official launch. It's publicly available. This map is a map that shows where naloxone, brand name Narcan, is available throughout Orange County. We do not have it available in every community yet. We hope to get there. I think I mentioned previously that we do now have it in the AED kits around the county. Some of our departments also have boxes on the wall that are free. Anybody can take those kits, bring them home, and we will keep restocking them. We have kits that we get for free from the state to make that happen. We're trying to get them in, they're all over SUNY Orange, for example. We now have the ability to put them in parks as well. And this is the opioid overdose reversal medication that really does save lives in our community.
Is there training that you need to do to have one of those kits?
You used to have training before you could have a kit. The training is very simple. So now on the side of each box is a QR code. You scan it and it brings you to a brief video. I think it's 3 minutes that shows you how to administer the Narcan or the naloxone.
Could you bring some to the next meeting, please?
Some naloxone.
The kits, yeah. Thank you.
No problem. I just also wanted to mention that Think Differently is collaborating to do a free movie event. It's a sensory sensitive screening of the movie The Unbreakable Boy. So they will do things like have the lights on so that it's not as dark, the sound will be a little bit lower. They're taking pre-registration so they know how many individuals with wheelchairs they may need to accommodate in the space. It's at the Paramount Theater. The flyer is in the back of the packet. And just to make sure that we are inclusive and that people who may struggle in a movie theater that's standard lights and sounds have the opportunity to see. I gave you a list of some additional suicide prevention trainings. We do try to have at least one per month. September being Suicide Prevention Month, we have additional, both that are sponsored by our department as well as Access Supports for Living sponsoring a few trainings. We are continuing to try to plan for suicide prevention events. One of the things we're looking at is tabling in the schools that we are in with our satellites to say, during lunch periods, be there, be available, have materials, just so we're getting the messaging out there that there is somebody there to talk to if you need help. Our mental health staff tabled at several National Night Out Against Crime events, also providing materials. We didn't have enough people for all of the events, but we did supply materials to go to all of the events for anybody who requested them. Our Welcome Orange Training Institute has a social media safety training that they're offering in September, and really in line with going back to school, the importance of making sure that we're talking to our kids about those things and that providers are prepared to work with youth who may be struggling with issues related to social media, whether it be them spending too much time on social media, bullying on social media, and the risks that with some of these the targeting of youth to get involved in things that are dangerous. We also have an additional psychological first aid training coming up. That is the training that we've spoken of before for natural disasters and mass casualty events, things like that, where we come in and help meet people's basic needs in the hopes that we prevent somebody from having a post-traumatic stress disorder diagnosis in the future. We are working hard to recruit clinicians for our satellite programs. Since we've added additional, we want to try to make sure we get as many of them up and running as we can. All of the satellites that we had in the queue, other than our Goshen office, which obviously is not a school-based one, but a location that we thought would be beneficial, particularly for our satellite clinicians who, during certain times of the year can struggle to get into school buildings. That's the only one we're still waiting on. And I just gave you some data. Our satellites are a little bit low, but that's normal for the summer because they're not in the buildings. And we had no self-disclosures in July and no systematic issues identified in our billing or clinical process.
Thank you. Anybody have any questions? Chairman?
Why is Monroe Woodbury so high and Newburgh so low? Is it the summer school option?
The consistency of being able to get in all of the buildings in Monroe Woodbury is higher than in Newburgh. Newburgh, we struggle, especially in the off times when they're closed in the buildings, to have access to those buildings.
Were they the first one?
They were early. Warwick was our first, but Newburgh was early in the process. And we also have a clinic in Newburgh, so it's very easy for people to get to services there. So it's not as hard as somebody who's in Highland Falls or Monroe Woodbury to get to our locations.
Any other questions? Okay, thank you. Thank you very much, Lacey. Okay. Up next, we have Dr. Jennifer Roman, Medical Examiner, Acting Commissioner of Health, Lisa Lee, Deputy Commissioner of Health, and Gretchen Meridan, Deputy Commissioner of Health. How's everybody? Okay, so first up, we have item A, request to appropriate year 5 of 5-year funds from the New York State Department of Health for the Childhood-Led Primary Prevention Program Grant for the period of 10/1/25 through 9/30/2026 in the amount of $533,000. Legislative request number 234.
So
Can I-
moved.
Second. Okay, thank you.
This is our childhood-led poisoning prevention program grant. It funds 2 full-time staff members, 2 staff members who are split between this grant and another grant. We also do a chargeback of county staff for their work on the grant. And additionally, it funds all of the supplies and materials that are necessary to fund.
Okay. Anybody have any questions? All in favor?
Aye.
Any opposed? Motion carries. Up next, we have item B, request supplemental appropriation of year 5 funds from New York State Department of Health for the Early Intervention Administration Program grant for the period of 10/1/25 through 9/30/26. Funds were previously accepted for the 5-year contract, $255,760. Legislative request number 235.
So moved.
Second.
Okay, this is our grant for the administration of our early intervention program. It funds a full-time coordinator and 2 part-time clerical staff, as well as the supplies and materials that are necessary for that program. We also have some travel.
Anybody have any questions? All in favor?
Aye.
Any opposed? Move on to our Thank
All right, thank you very much. The Orange County Department of Health is planning a staff development day on September 12th. This event was planned and paid for with the workforce development, planned by the Workforce Development Committee and paid for with the Public Health Infrastructure Grant. We've also used those funds to renovate the fiscal area in the 1887 building, which should hopefully be completed by the end of the month. The health department also participated in National Night Out. Just a couple more things I wanted to highlight. We do have information that medication that is crucial in the treatment of syphilis, which is Bicillin or injectable penicillin, has been recalled, which has created a shortage nationwide. So we are working with it. We do have our allotment, and we're working with our community partners to make sure that if it's necessary for a high priority case, like a pregnant person, that they will be able to receive their medication if it's necessary. I'll reiterate the part about childhood vaccines. We had a clinic already. Those appointments were full. And then we have several more clinics available. They're listed in the update. If you know of a person or family that needs immunizations to go back to school and they're uninsured or underinsured, we suggest that they contact the health department to see if they can make an appointment for one of those times. If we find out that there are a number of children who are being excluded from school because they haven't had the right immunizations prior to the start of school, then we will look at either extending the clinics that we have or adding clinics. You may have heard or read that that Orange County had its first West Nile positive pool in Greenwood Lake. This is part of our regular mosquito surveillance project that we do with SUNY Orange. We issued or helped the CE's office issue a press release about ways to prevent being bitten by mosquitoes. We also had our medical director spoke several times to different media outlets to provide information. And we have offered the mayor to have a community health educator come into the community and perhaps distribute the mosquito kits. We haven't heard back about that, but that might be something that we do in the future. The good news is that the test the next week had no positive pools, so hopefully we'll be good. I also wanted to let you know that on October 28th is the Orange County Department of Health's annual health summit. We have that every year. It brings together a group of community partners who are interested in a variety of different things, whether it's breastfeeding, maternal health, food insecurity, et cetera, to try to help us as a health department identify priorities, but also brainstorm among agencies and network. It's a great event. It will be at SUNY Orange. And our keynote speaker is Marissa Donnelly. Marissa Donnelly is a nationally recognized writer. She writes for your local epidemiologist. It's a blog and newsletter that became very popular during COVID. And Marissa is the author of the New York edition of that. So she'll be coming to speak about data and using data to drive healthcare decisions. There will be a free rabies vaccine clinic. These things are sort of new updates. On October 4th in New Windsor, and that's for cats, dogs, and ferrets. Can be immunized for free. And then we're celebrating on September 9th our 1-year anniversary of the Health Department Family Center program at the Armory in New York.
Questions? Do you have any questions? Thank you very much. Yeah, got your information. Up next, we have Lawrence Leduc, Commissioner of Valley View Center, and Donna Strecker, Director of Finance, Valley View Center.
Just me today.
Just you. Last month it was just Donna.
Her month to take off. I was off last month.
Yep, so we start with the monthly financials.
Financials, yep. So we're looking at this page here. We have not received any IGT money. I don't have any new information on IGT funds. I wish I did. As soon as we hear something, or if we hear something, obviously we will update you. Our revenues year to date are $19,814,160 on the revenue side. On the expense side, personal services are coming in at $12,367,405. Equipment expenses is just over $11,000. Contractual expenses are just over $5.1 million. Employee benefits are coming in at just over $9.2 million. And our bond debt expense is $32,000, just over $32,000, for a total of $26,733,770. And then you can see the 2024 year to date on the bottom for comparisons to 2025. If you go to the next page, you'll see our historical occupancy comparison. For the month of July, we ended the month at 61.55%, and we're averaging just under 62% for the year. If you go to our this page, the analysis of the billed days for so far year to date, we are coming in at Medicaid revenues based on days is 78.69%. Medicaid HMO is just 2.71%. Medicare is 13.22%. Private pay is 4.8%. Hospice is a small amount at 0.29%, and other private is 0.3%. So our total days so far this year is 47,282 days. And again, there's your census number for year to date, 61.95. If you take the census and you convert it to a possible 270 beds, which is really how we're operating currently, year to date, we're at just under 87% at 86.79%.
It's here, you have 200. Oh, no, okay. Never mind. 7 days too.
Oh, based on 240, you had two different numbers here. Sorry about that. Yeah. Yep.
Okay, are there any questions? We'll move on to the monthly update.
Monthly update. So today's census is 61.39. So it's it's right around the same amount that I wrote last week when I submitted this. And it's 92.8% based on 240 beds today. For July, we had 23 admissions, 11 new and 12 readmissions. We had 4 deaths, 8 discharges to the hospital and 9 discharges to home, and 1 discharge to another facility. The Valley View CHA census is currently 14, actually 16 today. It was 14 when I wrote this. For July, the CHA had 10 new admits, 8 discharges, and conducted 161 therapy and clinical treatment sessions. 99 of those sessions were physical therapy sessions, and 62 were occupational therapy sessions. We received our results from the New York State Department of Health recertification survey. We received 15 deficiencies. There were no harm to residents, and there were minor deficiencies in terms of scope and severity. The plan of correction has been submitted to the New York State Department of Health, and since I wrote this last week, it has been approved. So we are working on the plan of correction now. We have to have all of these items corrected within 60 days of their exit of the survey back in July. So we have to have all these items fixed by September 22nd, I believe is the date. Yeah,
Will you get the copies of that to us, or will we get it?
I'll send it to you if you want it. Sure,
I'd like to see it.
sure.
Or we
Sure.
do it online, how can we?
Yep, I'll email it to you tomorrow.
Yeah, if you could email to Doreen, she'll share with you.
Yep.
Thank you.
Yeah, yep. Okay, and then I have an update to the last paragraph. We have 3 LPNs starting on September 2nd, which is great. One of them is a full-time LPN who's going to take advantage of our, she just graduated, and she's going to take advantage of our reimbursement program for new grads, and we're going to pay for her class, reimburse her for her class, for her LPN class, and in turn, she's giving us a 2-year commitment. We have 2 per diem LPN starting also on September 2nd. Another one of those is a Duchess Bosse's grad, and I've already spoken to her about the incentive as well. So I'm hoping she comes on board, gets comfortable, and transitions from a per diem employee to a full-time employee. And then we have another Newburgh Bosse's graduate starting on 9/15. So we've had some, knock on wood, some early returns on this new incentive, and we're hoping to get some more hires as a result.
Great.
Yeah. Yeah, Lawrence, just wondering, know the number on the waiting list? I don't have that with me, but I'll email that. When I email you the information on the survey, I'll email that number too. It's a little bit. I mean, it seems like you have a decent amount of people going in and out. Yeah, the most people going in and out are on the short-term rehab unit. That's a 30-bed unit. The long-term, the waiting list is primarily for long-term residents. That's the remaining of the facility. But I'll let you know what the waiting list is. Okay. Okay.
Is that Department of Health recertification, is your rating going to go up, down, stay the same?
So that's not going to help us on our, so CMS has 4 components for the CMS 5-star rating. One of them is inspection, so our inspections could go down to a 1-star. It's currently a 2-star. There's the staffing, which we are 4 stars right now. There's the quality measures, which were 4 stars right now. Unfortunately, the inspection is the most heavily weighted, and it brings our overall score down, which is unfortunate.
Which will leave us at 1 or 2.
It'll leave us, I think, back to a 1. We do have an opportunity to actually get to 5 stars in quality measures and potentially staffing, which could raise us up to a 2-star. So,
Do you keep track of like repetition of issues with each report,
So yeah, there's a whole history. You can, what we do is we actually had I'm not very happy with the results, I'll be honest with you. This is the most deficiencies I've ever received as a nursing home administrator. I've been doing this for over 20 years. So I'm not very happy. Our staff could have done a much better job, but it's ultimately my responsibility. I am the leader of the facility. So, but yeah, you can, we actually had a mock survey about a year ago to help us prepare. Some of these items, and you'll see when I send you the report, it's, we get cited for 2 different tags for the same issue. You'll get cited for one thing here, and then you get cited on a different tag here for one issue. So that happened a couple of times on this survey for us. So they're all minor in scope and severity. I'll send you the scope and severity scale as well, so you can see that. And obviously, if you have any questions, just email me and I'll be glad, or we can talk about it next meeting as well. So,
Great, thank you. Anyone else?
yeah,
Thank you very much.
you're welcome.
Sure.
Thank you.
I think I just mentioned you want to put that in the agenda for the next meeting that we'll discuss.
Yeah.
Sure. Great, thanks.
Thank you.
Thank you. Up next, we have a resolution for the prevention of, resolution. Sorry,
Yeah, prostate cancer.
prostate cancer awareness. Thank you.
Motion,
Does everybody want to be on this one?
Yes.
Yes. All. Can I have a motion? Second? Thank you. All in favor?
Aye.
That clears the desk. Motion to adjourn. So moved. Second?
Second.
Thank you.